Dear distinguished guests, colleagues, I am really very pleased to be with you today, even virtually. My name is Olga Gvozdetska. I'm Acting Deputy Director of the Public Health Center of the Ministry of Health of Ukraine. Nowadays, Ukraine is passing through a period of struggle and fight and multiple challenges. The ongoing war has already continued for a total of 9 years, and soon it will be 2 years since the Russia full-scale invasion began. Even during these challenging times, we do not forget about another invisible opponent that poses additional risks to our population's health, viral hepatitis. Even today, the slogan "Hepatitis Can't Wait," chosen for the World Hepatitis Day in 2022, became extremely relevant for Ukraine. So instead of waiting, we take bold action. Every day we work hardly and tirelessly to meet our country's commitments to move Ukraine closer to eliminating viral hepatitis. In 2019, the Cabinet of Ministers of Ukraine approved the national strategy in the field of combating HIV/AIDS, tuberculosis, and viral hepatitis until 2030. The strategy requires that 90% of people with viral hepatitis should be diagnosed. 90% of people with hepatitis C should be cured, and 40% of people with hepatitis B should be treated. And despite the war-connected difficulties and ambitious goals, we continue to work towards them. The invasion has created serious risks to security, not only of the battlefield, but also in the civilian territories. In particular, one region of the country remains fully occupied. 9 more regions are in the zone of possible and active hostilities. The active front line is currently 1,300 kilometers long, and about 30% of country land remains mined. Doctors must deal daily with the reality, and the facilities where they provide services are being shelled, damaged, or destroyed as a result of missile or mixed attacks. Fatalities and injuries at the workplace have become common among doctors, resulting in a massive outflow of healthcare specialists from active combat zones to civilian territories or even abroad. This, in turn, incredibly depletes the public health system due to the extreme overload of medical personnel at work and professional burnout. Despite this, medical professionals in Ukraine show remarkable bravery and persistence and continue to do their job. As public health professionals, we are facing additional challenges. The disruption of logistic routes for drug delivery poses a significant threat to the decentralization of viral hepatitis diagnostics and treatment services initiated in the COVID response in 2021. The invasion has led to the loss of numerous healthcare facilities providing vital treatment. However, 190 out of 230 facilities are still operational or have resumed services even near the front lines. Recognizing the severity of limited medication access and treatment disruptions, we are aware of their potential to worsen the country's epidemiological situation, possibility increasing infection disease prevalence. Therefore, drugs for the treatment of viral hepatitis continue to be procured annually at state budget. The maritime blockade in 2022 disrupted medicines imports to Ukraine, so the usual sea routes were unable. But soon after, the country pharmaceuticals managers established new schemes, new routes, ensuring the arrival of state-funded medicines closer to the scheduled time. In addition, during the active military hostilities, we managed not only to maintain the nomenclature of medicines available to patients, but also to increase it by providing patients with the possibility of screening for viral hepatitis. In Ukraine, in 2022, the procurement of rapid tests for the diagnostics of viral hepatitis began at the expense of state budget. In 2023, almost 1.5 million rapid tests were delivered to the regions and distributed for more than 1,200 healthcare facilities. It has already allowed for increased testing compared to 2022, leading to the identification of twice as many cases of viral hepatitis C. Rapid virus hepatitis B tests are now in family doctor services, and 11 medical guarantee packages. A package since May 2023 covers military medical commission needs, aiding potential military recruits with virus hepatitis screening. To improve treatment access via streamlined diagnostic routes and updated medical care standards, pilot projects on telemedicine and virus hepatitis C treatment in narcological facilities, along with policy enhancements, ensuring blood safety and infection control are ongoing. We are incredibly grateful to our partners for their support, assistance, and contribution to the fight against virus hepatitis. With the Coalition for Global Hepatitis Elimination Assistance, public health center specialists are involved in the global community of liver research. With their support, Public Health Center has developed a national profile on virus hepatitis elimination, a resource that allows us to understand the current state of the virus hepatitis epidemic in Ukraine. Also, as a request of the Public Health Center, the WHO mission is currently evaluating the national virus hepatitis elimination program in Ukraine. In the end, we expect to receive recommendations on how to respond to the situation and strengthen the virus hepatitis elimination program, as well as assistance in restoring healthcare infrastructure and other virus hepatitis-related services in Ukraine. This shows that our fight does not stop for a moment. Our efforts aim to build a reliable network of healthcare facilities, a strong backbone to our defenders and civilians. We are moving towards reforms for European integration while ensuring state leadership in policy development and systematic management despite all the difficulties: shelling, nights without sleep, risk of complete blackouts, and meeting our loved ones who are gone or have already returned from the battlefield. We believe that light and truth will always prevail. We are fighting for our values, our freedom, independence, and democracy in our daily battles. And we are extremely grateful to the European community for their support and faith. Thank you.